Radiotherapy in gynaecology. So radiation treatment is used for curative purposes in localized endometrial cancer when surgery is not possible, and it is improving prognosis if it is used as an adjunctive post-op therapy. Then it can also be used in cancer of vulva, cancer of vagina, cancer of ovary. In ovary, it can be used as post-op adjuvant radiotherapy. Now the exact mechanism by which it acts is different. So these cells act on growing cells. So cell death is loss of reproductive capacity. This attacks the DNA and there is production of mutations. Now these mutations are usually lethal mutations which lead to destruction of the cells. Sometimes they can be sublethal mutation also. But most of the times we give radiation in such a way that they produce lethal mutations and there is death of the cells, and usually the cell only proliferative, like all cells are affected by radiotherapy, yes, but it is more sensitive towards the cells which are rapidly proliferating. So that's why it has a better prognosis in anaplastic cancers when compared to well differentiated ones. Then adenocarcinoma, then it is better in squamous cell carcinoma when compared to adenocarcinoma and sarcomas. Now the particles which are used in radiotherapy are neutrons, photons, alpha particles, or electrons can be used. Alpha particles are usually not used because they don't have a lot of like penetrating capacity. Electrons, beta rays are usually used, and they also, so how are they producing this so-called DNA damage? They act by attacking the hydroxyl group. So this free hydroxyl group is causing damage to the cells, and hence oxygen is very important to enhance the effect, the photon effect. Then radiation in the presence of anemia, infection, or scar tissue produces poor results. Now radiation can be external source radiotherapy or it can be internal source radiotherapy. So brachytherapy is in which it is an internal source therapy where the radiation source is placed closer to the body. So this can again be divided into interstitial, where it is implanted in the tissue, or intercavitary, where it is placed in the cavity like the uterine cavity. So gold, cesium, iridium are usually used, and under general anesthesia with self-retaining catheters, this is inserted into the bladder or like wherever we want to use it. So this is an example of intracavitary source of radiation. That can be then external beam radiotherapy can be there. So teletherapy is a form wherein which is a form of external therapy where radiation source is placed away from the patient. And now coming into complications of radiotherapy. So complications of radiotherapy are burns on the skin, then burns on skin, nausea, vomiting. It causes bladder irritation, which can be treated by which leads to increased dysuria or hematuria, can be treated by anticholinergics or chlorpromazine. Then it can lead to rectal irritation causing tenesmus, so again anticholinergics again. Irritation of small bowel leading to anorexia and nausea, vomiting. Then malaise, irritability, flare-up of sepsis, tubo-ovarian mass, pyometra, bilitis, pyrexia, pulmonary embolism, and skin reactions. Then late complications. Late complications include chronic pelvic pain, persistent anemia, pyometra because of cervical stenosis, proctitis, then post-radiation ulcers, small bowel strictures, obstruction, atopic vaginitis, fibrosis, vaginal stenosis, ureteric strictures, then fracture of osteoporosis and fracture of neck of femur, ovarian destruction leading to again post-menopausal syndromes, that is osteoporosis, and sometimes sarcoma. So it is contraindicated when you have a it's not contraindicated, but you can say when there is anemia, poor general health, sepsis, because your oxygen capacity of the tissue is reduced. Then in case of pregnancy because of damage to the fetus, anomalies fetus. Then fibroids in uterus, tubo-ovarian mass, uterovaginal prolapse, genital fistula, and obviously radio-resistant tumor. So certain chemotherapeutic drugs like cisplatin, carboplatin, 5-4-uracil, paclitaxel are radiosensitizers. So this is known as chemoradiation. And newer techniques like normal tissue sparing with optimal target to only the tumor cells, these different therapies are also available. Now, radiotherapy can be given pre-op or post-op. Pre-op to reduce size of big tumors, and then post-op for staging, for basically extent of locoregional